I'm Cain Linville. I'm a double board certified plastic surgeon in Houston, Texas. I do breast reconstruction, cosmetic surgery, fat grafting, all kinds of things. Lipoderma is fat that's taken out along with its scaffolding and the architecture around it, and then the antigens are stripped off. So it's something that can be used to inject as an implant for various reasons and all across the body. It has a lot of uses, a ton of uses that can be used for building up volume and replacing tissue. So the biggest problem with aging and what makes people look older as we age is the thinning down of our fat pads in our face. Basically, as the fat pads in our face thin down, it starts to make us look more like a skeleton. So the way that we've replaced that or kind of corrected that over time is with fillers and volumizing. So Lipoderma is taking what we've lost, the whole entire architecture and the fat itself, and you're replacing it perfectly. That's the beauty of what Lipoderma is. There's only one thing that really replicates what we lose, right? So our architecture in our body is 90% fat, 10% scaffolding or architecture. And that's what Lipoderma is. Everything else is a fall off from that, actually. This is why Lipoderma is such a big deal. Lipoderma is taking the exact same architecture and the same ratio and giving it back to us. So in plastic surgery, we like to say we replace like with like, and we reconstruct like with like. So if you're losing something, you don't want to replace it with something that's dislike that or unlike that. So if you take something that's identical to what you've lost, which is fat wasting, fat loss, in whether it's the face, the buttock, anywhere, and you replace it perfectly, that's your ideal replacement. Lipoderma is actually very easy to use. It comes out in the cannula, it's already frozen, so they freeze it cryogenically, comes out, and all you have to do is thaw it and inject it through the large bore enough that where it doesn't displace and mess up the fat. It's actually easier to use than doing your own liposuction and fat grafting, because then you have to take the fat out, put it in the syringe, transfer it into the syringe, and use something that works to inject it with. This is already pre-made. It's just like having a filler syringe that comes to you and you start injecting. So it takes out about half the process. It's super easy. I mean, I think the best patient use case is somewhere on the face, okay? That could be, I mean, there's a lot of uses for geographically on the face itself. Number one would be cheeks and sort of the under eye area. I usually say under eye is more like the orbital rim. I don't like to get fat up in the lower lid, okay, but under eye area. And then the cheek extending out along the zygoma is always nice because that's where we typically lose our fat from. That's the first fat pads that atrophy. So I would say cheeks, under eye, and then probably temples is another big one. So anywhere on the face is pretty much game. With Lipoderma, it's a brand new, amazing kind of concept with taking this fat, being able to clean it and not have an immune reaction is the biggest deal, I would say, in this current cosmetic realm or market. Being able to use this and the technology that's involved with this is the biggest kind of revolution that's going to change the way that we inject. Because it's everything that is a plastic surgeon who knows about science, who knows about immunology. We've been waiting for a product like this to come in that is like fat, or it is fat, that we can inject and use it as much as we want with no concern of an immune reaction. So we're really standing at the precipice of something brand new that we've all been kind of waiting on, and I think some of us just didn't think it was ever going to happen. But it has happened, and so that's the big difference, is sort of getting over that mental leap of, well, yeah, but we've all been doing this. That doesn't matter now. The biggest thing that matters now is that product that we've been waiting for, the ideal product has actually sort of come to fruition. And this is a totally different paradigm that we're stepping into. So it's gonna have a ton of applications that we haven't even thought about. It's really gonna change the world, and I can't wait to see where it goes.